We'll follow up, Senator.
Thanks very much. Thank you. Senator
Chair.
Hughes.
Thank you so much. Perhaps, Dr Murphy, you might be able to help me here. Even under previous administrations, including Labor, the state governments have primarily been responsible for their own state-run health systems. Wouldn't that be correct?
Certainly, Senator, the National Health Reform Agreement, obviously the Commonwealth provides funding under the National Health Reform Agreement under the IHPA pricing model, but it's always been the case that the state and territory governments have the operational and governance responsibility for the public hospital system. That's long been the case.
Yeah. And those state-run hospitals are also running their own elective surgery lists. Wouldn't that be correct?
Yes,
to
it's
assume
elective
that they are responsible for elective surgery lists?
Elective surgery is the operation of elective surgery is clearly a primary responsible of the state and territory health departments, governments and their hospitals. Again, the Commonwealth contributes in our funding share, but we do not have a governance or accountability function for the performance of elective surgery.
So with regards to elective surgery lists, wouldn't it be a little bit surprising when we have just seen some questions trying to draw COVID response and requirements to COVID outbreaks potentially to elective surgery lists, where in fact WA has shut down its elective surgery with 0 cases of COVID. So wouldn't it be disingenuous to link the two when in fact one state has shut down its elective surgery lists and has incredible ramping times without a COVID case? So, no, it's actually called the facts game.
Thank you.
So, Senator, certainly the situation in WA is not related to COVID because they don't have any active COVID outbreaks. I mean, it's true that in New South Wales and Victoria, COVID outbreaks did lead to some pausing elective surgery, but in WA, certainly that has not been a factor at all. They have a number of complex reasons why they've got a high acuity, high demand in their public hospital system. I mean, they've been we've provided all the funding including the growth under the National Health Reform Agreement that's been required, and they clearly have a range of complex issues with managing demand in their public hospitals, but it's not COVID related.
No. So could maybe we just get a quick overview of what the Commonwealth funding increase has been to WA hospitals versus the WA state government's funding increase, particularly in light of the particularly large surplus that Premier McGowan was espousing only a couple of months ago?
I'll get an official to come to the table with the WA breakdown, but I can give you the national breakdown so that the funding under the National Health Reform Agreement has grown from, the Commonwealth funding has grown from 13.3 billion in 2023 to 25.5 billion in 2019-20, which is a 92% growth. Over the same time, state and territory funding for their own hospitals has grown only by 44%. So that's 90.
From 13.
Sorry?
From 13.
13, yes, 2012-13 to 2019-20.
So 92% Commonwealth funding increase to a 13% WA state government increase.
No, 44% state and territory overall. Right. I'll get the official to come with the WA breakdown.
Look, I'm sure that we're pressed for time, but I think that gives everyone a pretty clear idea of who's investing in what health system.
I have got the WA figure here. So under that same period from 2013 to 2021, the Commonwealth funding has grown 72.8%. The WA increase is only 18.4%.
Wow, so we're almost talking 4 times. Quite a significant difference in the growth.
Yes,
By the way, it's still my questions at the moment. So if I can also just perhaps give some comfort to people that are listening in different states that might have concerns around scaremongering. Just a couple of quotes that I found interesting over the last couple of, really not that long ago. Brad Hazzard: "We have substantial capacity in our hospitals, and that capacity to have not only patients in wards but also in ICUs where the focus should be. We spent a lot of this last year with the health system, the doctors and nurses and administrators, looking to see what numbers might come through the course of the pandemic, and we've taken steps to make sure world-class private hospitals that are obviously provided by the federal system, that are on standby for now and any increase in patients when we need it." So that was Brad Hazzard on the 30th of August. Now, interestingly, in Queensland, where we have seen some ramping, we have seen some cancellations of elective surgery. I think yesterday we had 2 cases of COVID, but certainly no outbreak. I was confident we could cope at the start of the pandemic, and we didn't have anyone vaccinated then, and everyone was at risk. So I'm absolutely confident we would be able to cope with people vaccinated. That was the Queensland CHO, Jeanette Young. So there is a question to this. So I'd just like to give confidence to Senator Murray that Queensland seems to be very, very comfortable. And in fact, Premier Andrews said yesterday that hospitalisation numbers haven't been as high as modelled. So, Professor Murphy, has there been any hospital system that has come to you, unlike what Queensland, New South Wales and Victoria have now expressed? Has there been a hospital system or a CHO or a health minister come to you to suggest that they would be unable to cope with a COVID outbreak?
Yes.
Well, the 3 of them. Excuse me, that's not the question. It's not the question because there's 3 of them who have just said that.
Order. Senator Hughes, please direct your question.
So I was directing the question because we do know there isn't a state government that wouldn't take more money could they get it at any opportunity. But has there been any incidents where a public health system has not been able to access or has been overwhelmed even with private hospital access, who hasn't utilised their ICUs, who's had no access to ventilators because they've run out of ventilators at any stage, particularly when you look at what the level of vaccination rates are now, and in light of what the CHO in Queensland has said, that she had confidence pre-vaccination rates, do you think that there is any risk that we are going to see at 90% vaccination as New South Wales and Victoria open up, running out of ventilators, inability to cope?
Thank you, Senator. So I think the experience in New South Wales and Victoria has been reassuring. They both had significant outbreaks that started before high vaccination rates were achieved. So, and they could have, that's why with the opening up of other states where the planning in those states is not to try and keep COVID out until they reach the high vaccination rates. New South Wales and Victoria unfortunately had outbreaks, but the experience in New South Wales has been incredibly reassuring because it has exactly modelled what Doherty predicted with the high vaccination rates, the controlling transmission. They had some other modelling that suggested they might get to a stage where they would really stretch their ICUs. They didn't get there. They managed it at a much lower peak and they've clearly come down significantly. Victoria is earlier in its journey and they still have a number of people in hospital. And of course their hospitals, you know, they have some pressure because they had an outbreak before they reached fully vaccinated status, but they are coping and we're working closely with them to support them. But it's very important to recognise that the national plan does not envisage widespread COVID transmission until people are fully vaccinated. Now, what we've seen in New South Wales is with high vaccination rates, it's an incredibly effective public health measure. And New South Wales is now starting elective surgery again. And, you know, we did provide the 100% private hospital guarantee so that they could use private hospitals when they were in their height of their outbreak, but it's come under control well. And Professor Kelly might comment, but we think that Victoria is peaking and is probably also heading in a downwards direction. So that gives us great reassurance that the modelling we have presented to National Cabinet and the work that Dr Sonia Bennett, who's here, has been doing with all the states and territories senior officials, where they have all carefully modelled their capacity both to live with COVID in a low-level controlled manner, and they've also modelled their capacity, if they do get a large outbreak that's unexpected and not planned for, that they have the surge capacity. And they have all provided that assurance to the National Cabinet. Via the First Ministers have all provided assurance that they have a surge plan and could meet an outbreak like New South Wales or Victoria if it happened, but we don't think it will happen because we believe that those communities will be highly vaccinated. I don't know whether Professor Kelly would like to talk about Victoria.
Perhaps, Professor Kelly, it's important to note here, because I do realise my time's running out, that it's probably more important that we acknowledge the success of the high vaccination rates with the lowering of transmission, the lowering of hospitalisations, and perhaps encourage public confidence as opposed to run a scaremongering campaign around lack of capacity, which is clearly not even a relevant point.
Professor Paul Kelly, Chief Medical Officer, thank you for your question. Senator Hughes, short answer to that is yes. We have heard from General Fruin, and I'm sure we'll hear more during the day, of the clearly spectacular rollout of the vaccine over this year, and it has changed the whole way that we should be approaching this pandemic. In terms of what it's done for all those things you mentioned, it decreases people getting infected, it decreases transmission to others, it decreases severe illness, particularly those in the most vulnerable groups. And we can see that, and as the Secretary has mentioned, New South Wales has actually exceeded what they thought they would be, and they started their outbreak at a relatively low vaccination rate. All states and territories, recognising there are some pockets where it's a little bit lower, but on a state and territory level, everyone is beyond that now in terms of the vaccination rollout, so they should feel confident. We've got comparisons with overseas. So in the UK, they're seeing a lot more cases at the moment, but their hospitalisation rates have not gone up as they did in previous waves. ICU has not been overwhelmed as it has been in previous waves. We have the modelling that's been mentioned by the Secretary in relation to what we think might happen, but we've got real-world experience in New South Wales and in Victoria that hospitalisation rates and ICU rates are decreasing despite the increase in cases, decreasing. For several weeks that's been the case. And particularly intensive care has not been anywhere near overwhelmed, as some have predicted. So I feel very confident on that basis, and we might get Dr. Bennett to talk more about the specifics of the work she's been leading with the states on hospital services. But we do need to remember there is a model of care which starts with self-help, Health Direct and other sources that we can can assist people, primary care and the hospital system. That is the last part. But I am very confident that we are in a very good space right now in Australia.
Excellent. Thank you. Thank you, Chair.